Hello, my name is Kathleen Lisson, and I am a certified lymphedema therapist, board certified massage therapist, and author of the Plastic Surgery Recovery Handbook. I am going to discuss with you today 2 things that you should think of when planning on choosing a surgeon. And most of the people that I hear their stories online, they're only thinking of one of them. So I'm going to kind of break that apart into 2 and tell you a little bit more about the 2 things you should focus on when initially choosing a surgeon. So I am going to show you in chapter 2 of the Plastic Surgery Recovery Handbook. I have not 1, not 2, but 3 whole pages of questions that you should ask your surgeon to figure out how the recovery from your surgery is going to be in detail, this is the number one thing I hear from clients after surgery that are coming to me for lymphatic massage, for fibrosis work, and it's this confusion on what really is a recovery time from surgery. Is it going to be 2 days? Is it going to be 2 weeks? What's the difference between getting out of the hospital and then fully being able to work a 40-hour work week? So I really drill into the answers in the book. This is a great book that you can take to the surgeon at that pre-op visit to get the answers and just write them down in the book to get the answers to those questions. But today I want to even go back further and hopefully catch some people who haven't chosen their surgeon yet, or maybe they've chosen their surgeon but they're doing still more research and they're feeling a little bit uncertain about their decision. So I want to talk about the 2 things that I see that are very important in getting a surgeon and a procedure and a recovery that is the one that's right for you. So the first thing to know is that it is individualized. So someone, as we're doing our research to choose our surgeon, we might hear good stories from everyone. We might hear bad stories from everyone. But the choice is actually, it's individual. It's based on who are you, what do you want in a surgeon, what do you not need in a surgeon, what kind of result are you getting at? So I want to be really specific here and give you a lot of value. So first, we'll talk about the traditional research techniques. So what I've seen when people are looking for a surgeon, doing their research before plastic surgery, is they're looking at the websites of the surgeon. So that's where you're going to get the before and afters. You can also look online. You can look at the reviews, the positive reviews. There's websites called realself.com. There's also looking on Instagram, following other people who are having their surgery journey and using surgeons that you're looking, are in possible surgeons that you might want to use in that final list of surgeons that you're really looking at. There's also going on the interview with the surgeon, interviewing the surgeon, getting a consultation. So what I see that can potentially trip people up is when they're doing this kind of research, they're looking at the befores and afters, and they're seeing the ideal cases. So I think we all know that the surgeon's not going to put a case that isn't with a happy client. They're going to put their best results up. But what we don't see in those pictures often is the scar, and the scar is very important. What is the quality of the scar? Did it heal up nicely? So I definitely ask, if you're in a consultation, to look at pictures, the befores and afters with the scar, and see what the quality of the scar is, because that's definitely what I hear from clients is, when is this redness going to go down? How is the scar going to look? How long is it going to take to look the way it does? And the other thing that I think a lot of people don't really think of clearly is when you're seeing that before and after, that most likely is not just someone who had the surgery and then just went on their way and didn't spend any additional money on recovery. So recovery can be a long process, and it's something where you need to wear the compression garment daily. You need to get a new compression garment. You need to get lymphatic massages. If you get fibrosis, you need to get fibrosis massages. It can cost definitely easily upward of an extra $1,000 for recovery, for a very full and complete recovery. And it's different based on your level of activity, your level of health, your age beforehand, how much surgery did you get, how many different surgeries in the same day, like a little bit of liposuction, a lot of liposuction. So there's a lot of variables, but one thing that I would feel confident is if you see a before and after of this amazing, spectacular result, it is not just what the surgeon did on the table. It's what the client did after they got home that made the ideal result. So definitely if you can get a hold of some clients that have had a good result with the surgeon that you're thinking of, definitely ask them, what did you do after surgery? What was your nutrition? How much did you have to pay attention to that? How much did you have to do lymphatic massages? When did you start exercise? How long did you do the exercise? Were you super passionate about it? How was the compression? How long did you wear the compression garment? Did you go into a stage 2 garment, or did you just go into like some shapewear from the mall? Like, how serious were you about the post-op care? And then that can be, how serious do you individually as a person, how much energy do you want to put into your post-op care? So that's the first thing, looking at these things and figuring out the right questions and how to see clearly what those before and afters are actually going to tell you. And the second thing, that this is the secret, the thing that not a lot of people talk about, and I want to talk about in this video, is what kind of experience do you want from your surgeon? What kind of treatment do you need as a client? I have some clients that are very college educated, and they come to me because I have a degree in massage therapy, because I'm a certified lymphedema therapist, because I'm an author and a speaker, and they want to see the research on everything that I suggest, and they want to know that everything I suggest isn't something that I heard from someone else, but that it's backed up with scientific research. And they want to have that conversation, that back and forth with me, and not just receive a list that they will follow blindly, not actually needing to know why. They definitely want to know why, and they want to be an active participant in their treatment. So that client needs a doctor that is not going to just give them a 1 page of post-op care and kind of tell them to go off and everything will be fine, and their swelling will go down eventually, and kind of give them the brush off a little bit. So I have these clients that come into my practice and they feel it's usually a surgeon that I haven't worked with before, and they found me online because they're doing all this research because they don't feel supported by their local surgeon. And the heartfelt message that I get from them is, I really want more conversation. More than one time I've had a client tell me, I feel like as soon as the surgery was over, they weren't interested in me as much anymore. They just, they see what they see as doctors, and they don't see that it's a big deal. So they're just kind of telling me, patience is fine, just wait it out, everything will get better, don't worry about it. And that can be very frustrated for someone who wants to have a more serious conversation, but the exact same thing can be very, very reassuring if you are just overwhelmed, you want the surgery, but you don't want to get an online degree, you don't want to do a lot of research, know all your options. You want to choose someone who will do those choices for you, who will take care of you, who will always know the answer, just tell you. You don't need the explanation, you just need your direction, and then you'll go. So that client is totally different from the client that wants to do a lot of research. So the biggest thing as a potential plastic surgery client is to be self-aware. Do you want to have the intense conversations? Do you want to have a binder full and really understand and learn thoroughly the process? Or do you want to kind of be taken care of? Someone do all the worrying for you and just be able to kind of blindly trust them and know that whatever they say, you're going to take it at complete face value and just be super comfortable with that, because you don't want anything kind of left up to chance, or someone to feel like you have to be an active part in it, making decisions that perhaps the surgeon, the expert, should make the decisions, not necessarily you. So this is, both clients are equally intelligent, both clients are equally going to have a good result, but they're only going to have a good result if they pick the surgeon that matches the kind of experience that they want. And then, so some surgeons, they will give you the phone number. They want to talk to you the day after surgery. They want you to call for any, little thing, whatever concerns you. They want to know it. They want to take care of it immediately. Very much a VIP experience. And then, so some people definitely need that. And then some people I've had who are more kind of self-reliant, they're really confused when I email people, because I email all my clients the day after, and I say, how did that feel? How are you doing? And they're kind of, we had a conversation where this wonderful lady was just like, I was never sure why you were always emailing and always wanting to know these things. Cause if there was a problem, I would have told you. And I wasn't sure why you were doing it. So then that's just kind of like a mismatch. So you need to figure out, what works best for you. So that's, kind of my idea in a nutshell. And my one other bonus tip is some people in the post-surgery recovery world are open to giving you their thoughts of what they've seen, and some aren't. So I know at least one recovery nurse that will not tell you if someone walks in off the street or DMs her, she doesn't want to give names out of the surgeons that she's seen the best work from, because her idea is, some surgeons give these wonderful creative results, and some surgeons are more of, more of a natural result where you wouldn't get that second glance on the street. And the client needs to know what's best for them and choose their own. But from my perspective, I am someone that will give advice out. So if someone comes to me for a lymphatic massage, maybe they're 6 months or 12 months away from plastic surgery. They know they want the tummy tuck, they know they want the liposuction, but they're not sure, how to start or how to get their research done for a doctor. They're looking to, stay local in San Diego, and they want some opinions on someone, an expert, like a person like me that's seen like dozens and dozens of cases, dozens of patients coming to me after surgery, after plastic surgery, with local plastic surgeons here in San Diego, a variety of different local plastic surgeons, and to kind of see who's saying what about which doctor, and who's having a really good result, and who's having, like a really fast recovery, and who does just this amazing work, and who is not afraid of doing, like revision surgeries or surgeries for people who have had a cancer history. And maybe another doctor would say no, but this doctor, would be confident enough to do surgery. So I'm the kind of person that I would evaluate the client, kind of get some information about the client, and then give them a few options, like, interview with this doctor, have a consultation with that doctor. So that would be a great option if you're in San Diego, or if you're somewhere, wherever you are in America. My advice would be, if you haven't chosen a surgeon yet, choose your lymphatic therapist first. Find someone that does lymphatic massage and just go for a session. It's easy. It's very relaxing. It's positive for your health system to get this massage, and then you can kind of ask them the questions that you want and kind of get an idea about which local doctors are good, which local doctors are responsive, kind of those tips that you really can't get from anyone else, because each person who's had surgery has only had surgery with one or two plastic surgeons, but someone who does recovery care has seen all the work from all the surgeons. And if work goes wrong, very importantly, how do those surgeons treat the client, so the clients feel taken care of if they have a side effect, if they have a complication, if they have, some concern before or after the surgery, how well taken care of do they feel? So all those things I could definitely share with people. So definitely look for the lymphedema therapist in your area. If you're looking, and you really can't decide between some doctors, or you're looking for, there's over 100 plastic surgeons in San Diego County. How are you going to drill down? How are you even going to figure out the 5 that you want to focus on to research. And then the one other bonus tip is if you look on the Real Self website and you find the names of surgeons that you like, and you look on that website and you look at their profile, some surgeons, locally surgeons all over America, will give a free consultation. Some of them will offer a discount if you book your consultation through Real Self. So getting that free account with Real Self is very valuable, and then you can see how they answer a lot of other clients' questions, and just how their practice is. You can see some non-biased reviews on Real Self from clients that are kind of verified reviews, and then hopefully if they have a discount or some kind of special, you can get in there and get that discount, so you can see a wide variety of surgeons and really make an informed decision. So that is my tips. So of course my first tip is always to grab this book, so when you do go in on those client consultations, you can have those questions about recovery ready, and then use your resources, use what's involved locally. Websites like Real Self can help too, with giving you more information about your surgeons as you choose a surgeon for your plastic surgery. All right, have a great day.